I was going to talk about my wife first, but after hearing this about chelation, I would like to just address that issue for a minute. Before I ever met Dr. T, back in '84, I told my wife that if I had to continue to do my job the way I had done for years, I wouldn't be able to do it because I couldn't concentrate enough for what it took. And of course, so I had 2 physicals. Everybody said you need to quit smoking, quit drinking, all this stuff, and that was all that the problem was. In '86, I found a clinic up in Plano when we moved back from Canada, and had all the tests run up there, all the ultrasound and everything else, and they ran light beams on my toes. They couldn't find any blood circulation in my toes. There had to be a little bit, or obviously they'd have been dead, but it was so slight they couldn't find it with light beam. Back of my legs were 88 to 92% blocked. My carotid arteries were as close to 100% as they could determine. And it just went on and on. There wasn't any, and the doctor finally said, you know, really, it's only by the grace of the good Lord you're still moving. You should really be dead by now or have had a stroke. But you will not see Christmas. We can guarantee that. You won't be here in 3 months. Nobody can survive this. I ended up taking chelation treatments in Austin, Texas at that time. The difference, and it saved my life. It went. And to address that issue of feeling that difference, the first 20 probably saved my life, but from 20 to 40, nothing happened. And I thought, oh, this isn't going to work for me. But from 40 to 60, it just took the rest of the blockages out. And I stopped at 60 treatments. It saved my life. The difference being, when I met Dr. T later years, he supplemented the whole thing with better chelation and the supplements that it takes to put the things back in that up there, it was just strictly take it out and go with it. So as far as chelation therapy, you cannot find better than to have Dr. T and his staff do it, because it's really a better a protocol all the way through, because they're treating the whole body, not just roto-rooting out the harmful. So I would encourage you to do it like that. But it does work. It saved my life, and it's saved a number of people that we've referred for it. There's nothing that matches it. But what I really wanted to talk about a little bit was reconstructive therapy. Back in 1992, my wife Barbara was involved in a serious car accident. Her little car was totaled when a truck hit her at 75 miles an hour in the back end, put the back wheels right up to the front seat. I remember when I got there at the scene of the accident, the officer that arrived first told me, he said, I don't mean to say that I was slow, but he said, when I pulled up, in my mind, I said, there's no reason to get in a hurry because nobody's alive. And obviously she was alive. She's here today. But a year after the accident, after all the orthopedic surgeons and chiropractors, sports medicine doctors from Austin to Dallas, we had the Dallas Cowboy sports medicine doctors treat her. The whole issue was she couldn't raise her arm, even horizontal. And that was the big issue. And at that time, the good Lord intervened and said, you need to be aware of this. I read it, actually, it came from your friend out in California in his medical newsletter about reconstructive therapy. And so I researched that, and the doctor up in Dr. Faber up in Milwaukee is the one that referred and said, you need to go see Dr. Trowbridge about this. At that same time, we saw a neurosurgeon who referred us to a shoulder surgeon in Houston who supposedly was one of the top in the world at that time. That gentleman did a full evaluation. And when he was done, he sat down behind his desk and he says, if you were my wife, you wouldn't be having any shoulder surgery because it will not work. It cannot be successful. And it won't be me doing it. But you wouldn't be taking these painkillers either because they're not good for you. You'd be going to see this man, and he's writing as he's talking, and he pushes the card across, and he said, this man has been gifted by the Lord with that rare ability to almost see through the human body down to the DNA, almost like an electrical engineer can see how electricity flows through all the components on a schematic. He can just see it, how it flows through to the intended purpose. He said, so this guy has this rare ability. And he said, that's where you would go if you were my wife. But he said he's a radical, he's a maverick, he's hated by a lot of doctors, but he said that's the way it is. And he pushes the card across, and it's Dr. Trowbridge. So now you know what you're up against, okay? Well, so we came and saw him. He told Barbara, this is the way it's going to happen. And 16 treatments later, Barbara had full range of her shoulder, full movement. And it was really critical because that was her bridge hand, okay? And so it really was important. I mean, you can't slap those cards down if you know. Anyway, the irony is that out of the whole thing, I saw how successful this was. I said to Dr. T, you think you could fix my back? When I was 23, I got hit in the back with about 700 pounds and knocked off a drilling rig and landed on a bunch of railroad ties, and it pretty well did a number on me. And so I've lived with a lot of pain, and one time I was 6 months, my sciatic nerve locked up so bad I was about 6 months recovering from that one. And he does an examination, says your back would be a piece of cake, but it's your knee that has to be addressed first. And I said, we're not going down that road because they want to do a knee replacement, total knee replacement. So I'm not going to have it. Something will go wrong. I'll end up worse. So I went and had all the x-rays and everything else, and he said, I've never done a knee quite messed up like your knee, but if you've lived with it all these years, maybe we could fix it good enough so that you could keep going and let me do your back. In the end, he fixed my knee, he fixed my back, he's done my elbow, he's done my other knee, and they've all been successful, completely successful. I am absolutely amazed. I still do at times some heavy lifting and things like that. All of it has worked. There's just nothing that hasn't. And last year, of all things, Barbie came down, we were on vacation, and her arms swelled from her wrists all the way up to her elbows, swelled up. You'd have thought it was like elephant's feet, is what I call it, almost like they were going to burst. And so anyway, Barbie's allergic to doctors in general, and Dr. T in particular. She does not like to get near the clinic. But anyway, she came down. I don't know what he did, but anyway, that was a year ago. We don't have that anymore. It's all taken care of. But out of the whole thing, he had her go through a complete physical at the Herman Heart Hospital. When they were running all the tests, they found out she has severe heart blockages. They gave her 3 years to live. And so now she's undergone chelation therapy. It's pretty well under control. She's pretty well has it whipped. She's going to, by Christmas, she'll probably be done taking treatments. And it's all been because of the protocol that Dr. T and his staff use. I mean, you just cannot find better medical treatment anyplace. So I would encourage all of you, to do what that shoulder surgeon told me. Just go see him and do it. Whatever he says, just take it to the bank and do it. Thank you for your time.
So let's talk today about slipping on the banana peel. It's closer than you might think. And personal pollution does involve matters of the heart, your heart. When we talk about this, it's years of a problem forming, but only seconds in which everything seems to happen. It seems so sudden, but it has very real implications for your life. First, you think maybe it's got to be indigestion. It certainly can't be something more important. And you go, maybe if I just do something simple, because this can't be happening to me, I'll take some antacids or something that'll settle my stomach. That indigestion gives way to an impending doom, and that feeling necessitates the call to 911. Of course, when seconds count, the ambulance is only minutes away. The problem is, that's at that point your last resort. Finally, they arrive, and the EMTs, very skilled. We have the most incredible training system for emergency medical technicians in this country. They're able to calmly start everything, do the IV, do an EKG, get transport arranged, put the oxygen on. They literally save your life, and especially now that we have the paddles virtually everywhere, you have no idea how many people are saved from their heart attacks. You finally arrive at the emergency room. The Cardio 1 team goes to work. They're very reassuring. Thank God you figured I survived this long, because they know what they're doing. They will get you stabilized. They will give you medications that will help relieve your discomfort, help relieve your stress, and you begin to feel maybe, just maybe, it was only indigestion. I'll be okay. They transfer you to the coronary care unit. Nurses there who do this as a routine day in and day out reassure you that you've got a wonderful doctor, you've got wonderful nursing teams, you are doing well. And your medications are less than they would have expected, so life is wonderful. And the reassurance then comes from your doctor. Some doctors are full of false reassurance. They're called actors. They're on TV shows. What you want is a real cardiologist who really knows what he's doing. And he says to you, here's the story. Here's the real skinny. Here's how it's going to come down. And we're going to find out what's going on with you, and we're going to fix it. It's when they say, and we're going to fix it, that I have the reservation. Again, that banana peel is frighteningly close to each one of us. Is it a slippery slope? Sometimes you get in the hospital, it feels like a conveyor belt, and it's a one-way road to the heart operation. Many terms are applied to this. They call it workup. They call it treatment. The important thing is you're now going to go through some experience in the hospital. Now, there are some risk factors for heart disease that can't be changed. If you're a man, you're stuck with that. Your age, women after menopause act like men. There's a lot of controversy as to why this is, but you begin to have the same rate of heart disease as men. Heredity, you know, the genes. If your parents had heart disease, particularly if you're a father, if you're a man, your mother, if you're a woman, but there are other family relationships. And of course your race, because if you're black or Hispanic, Amerindian or Native Hawaiian, you have a higher incidence of heart disease. What's an obvious risk factor? Well, COPD, lung disease, chronic obstructive pulmonary disease, emphysema, especially from smoking, of course. How about elevated cholesterol? Only if it's severely elevated, not if it's just mildly elevated. A lot of the attention that's been placed on that has been misplaced, and we'll discuss more of that lately, but not just a few dozen points. Major elevations of triglycerides also matter. Now, triglycerides are a different form of blood fat, but again, a separate risk factor. And again, only major elevations matter. High blood pressure, certainly one of the, what I call hidey-hos, the high cholesterol, high triglycerides, high blood pressure, high sugar, and so on. Here's another one, physical inactivity. Anybody recognize this? Of course. It's been a hard day at work. We come home, we crash. And obesity, or as we'll learn later in this talk today about obesitis, a problem affecting a vast number of Americans. And diabetes. This one is really important. This one gets everyone who gets it because you are rusting the inside of your blood vessels. Here's another one called metabolic syndrome. It's an apple shape to your shape, and it involves what we call central obesity, or fat around the middle, high blood pressure, high blood triglycerides, low HDL, the heart protective cholesterol, and insulin resistance, which we'll also discuss later today. And another risk factor you probably haven't considered, inflammation. Inflammation is the secret killer, which is why we're devoting a whole lecture to it. How about another contribution to your risk called stress? Only 2 times I feel stress, day and night. Another contribution, excessive alcohol intake. Now, beyond 2 drinks a day, you're starting to get into a worrisome range. 2 beers, 2 glasses of wine, 2 shots. The red wine may have a protective effect that's worth doing, but if you're not a drinker, don't worry about it. How about high fructose corn syrup? HFCS is what it sometimes appears on the label. It's also called corn syrup solids and so on. It's one of the great challenges of our time because we are literally pouring it into everything as a sweetener. Something else you might not have thought of, MSG. MSG and similar food additives serve as excitotoxins. In other words, they jazz up your brain. Remember, the tobacco executives appeared before Congress, swore that they didn't do anything unusual to the cigarettes, except there was all this evidence that they were doping them, adding extra nicotine and extra chemicals, which of course would make you want more cigarettes. We're doing the exact same thing to our foods, but not the good foods. We're doing it to the bad foods. Now, interestingly, heart bypass has become commonplace, but only 1 person in 6 actually requires the operation in order to have a protective survival advantage. What that means is 5 of 6 who get the operation could do just as well with medications. Now you go, well, that's kind of news to me. Might be to you, but we knew this 30 years ago, before we had so many more of our medications now that are available that are so much better than what we had then. And yet the studies came down showing 5 of 6 did not need the operation. So what of the other 5 in every 6? Well, the VA study, reported in 1982, showed there's some evidence that the advantage of surgical therapy over medical therapy for relief of angina chest pains may only be temporary, lasting 3 to 7 years. More and more patients are requiring reoperation as their symptoms return, so that it is not uncommon to see patients who've had 2 or sometimes 3 bypass operations. How many of you know someone who's had their first heart operation, then their second? Or as I ask, if it did so well to fix your problem, why do you still have another heart surgery requiring problem? If they didn't fix it the first time, why not? If they did fix it, why are you back? Well, the EKG is what they put on when you show up in the hospital. And then they say, we're really glad to see that your rhythm has stabilized, you're looking very good. But just to be sure, we'll put you on a 24-hour monitor. Now, that's what they do in the coronary care unit, or have you wear around if you're released as an outpatient. It's called a Holter monitor, checking your rhythm, just to be sure. We do with ischemic patients, we can document blockage disease in arteries. The clue, however, is that this could be due to magnesium deficiency or even B vitamin deficiencies, creating episodes of heart artery spasm, where the artery narrows not by blockage, but by squeezing down and then letting go. So ischemic patterns have to be figured out. Unfortunately, many of our doctors consider that pattern results only from blockage disease, not temporary blockage caused by spasm. When I talk about vasospastic disorders, the red area in the middle of the slide shows what would be called normal vasotone, or what your artery would be open as. If it's opening wider, it's called dilatation. If it's narrower, it's called spasm. You might imagine that spasm can make a huge difference in the amount of blood flow going through to areas of your heart. And indeed, it makes it look just like the artery has been blocked. Well, blockage of an artery is not any good, but spasm of an artery is so much easier to fix. Unfortunately, it's not always figured out, and patients suffer with further angina, chest pains, heart pains. They take heart medications. Sure enough, they happen to work, although that's using a sledgehammer instead of a screwdriver. It's using something to force the vessels to work rather than to tease them into working. So figuring this out, you might imagine, becomes an important issue. Unfortunately, if it's not on the list, it's not being looked for. You need to understand the term vulnerable plaque. Now, this is one that came about almost 30 years ago when we were looking at why do people suddenly block their blood flow. If you have plaque or blockage forming in the artery, you can imagine that it's smooth all over the surface, but that's not the case. If it has a little roughening or a little opening at the end where the blood is flowing in, blood can flow under that little edge and flick off pieces that then go forward and find some place smaller, some blood vessel smaller than the piece, and that causes a little bit of a heart attack, or a little bit of gangrene, a little bit of blindness, a little bit of a stroke, and so on. I love the term, you've only had a small stroke. That reminds me of being just a little bit pregnant. So vulnerable plaque is something we look for because we can see often in the outlines that are done, the sound wave tests, ultrasounds, we can see irregular surfaces on those plaques. That gives us more concern that you're going to need surgery as an option rather than simply medical treatment. Now, heart attack actually equals a clot. You've seen this on some of the commercials on TV. The narrowing has proceeded to a certain degree. As local conditions change, the platelets get excited, they plug up the zone, and the blood flow stops, does not go beyond. At that point, we're talking about a heart attack. And so when you have this, you'll notice the purplish area on the lower part of the heart. That is where the blood flow has been compromised. In other words, stop. And there will be some scarring because there will be some death. Now, just to be sure, we've got you in the hospital, we should do a stress EKG. Now, we should check to be sure because this test will provoke changes where circulation has been compromised. So if you go in looking okay, but having come in kind of suspicious, this is one of the tests that can help bring out more of the details of your condition. Now remember, by the same processes that happen for a heart attack, circulation can be compromised in other tissues. The eyes, for example, this is a retina. The feet. A stroke is where the compromise happens in your brain. Dead tissue can result from clots that actually plug up a blood vessel going to a part of the brain, or by a bleed that happens there because you're in an enclosed area called the skull, and that bleed then squeezes so that the blood circulation is squeezed off, and effectively that blocks the flow as well as anything else. Kidney failure occurs where the blood vessels are actually in your kidney, and trust me, you do need to have your waste management systems working well. Macular degeneration is a term you might have heard. Unfortunately, many of the eye doctors think the treatment is to water them and watch them. That's the treatment classically for a stroke, water them and watch them. However, there are newer advances in the treatment of macular degeneration, and while it's in its early stages, chelation therapy, which is a treatment we'll talk about, can be intensely successful. Gangrene happens in the smallest areas farthest from the heart, the fingertips, the toes. It's where we are looking for problems because that's where the blood vessels become tiniest, turn around and start heading back from the circulation in the tips back to the heart. So we have arteries and arterioles going out to what's called capillaries. They turn around and come back in veins. So you might well have understood that, but you can see gangrene is pretty impressive. Let's talk for a minute about stroke warning signs because these are important for you. Remember, if you have a change that would indicate something's not right, called numbness or weakness, confusion, vision changes, trouble walking or dizziness or loss of balance problems, loss of coordination, severe headache. Now, some people might not think a severe headache would fit in. That might be the only thing you need to notice as a stroke. Good reason to go to the emergency room because, as I said, water them and watch them is the old byword. We have much more aggressive treatments now. Stroke versus TIA. You might have heard the term TIA and you go, what do that mean? It means a come and go stroke. The technical term is transient ischemic attack, but that's doctor talk. It's just a come and go stroke. The good news is it came, but it went. How do you know that one is a come and go compared to a regular stroke? You wait and find out, does it go away? If it doesn't go away, it's a regular stroke. Well, isn't that like finding out after the fact? Somehow that doesn't sound fun. Let's talk about stroke risk factors, just so you remember. High blood pressure, smoking. Why do I keep coming back to smoking? Because of the toxicity associated with it. It's not normal to put toxic things inside your body. Sugar diabetes, any kind, type 1 or type 2, very important risk factors for stroke. I learned how to control diabetes at the National Institutes of Health in Washington, D.C. a long time ago. The principles are very simple, very straightforward, and every diabetic patient can be extremely well controlled and minimize the risk of stroke, heart attack, gangrene, and so on. Carotid neck artery blocking, which is called atherosclerosis or arteriosclerosis, is another important one because you have 4 main arteries going up to your brain. You would like to keep 4 main arteries going up to your brain. So if you're starting to get blockage disease, which can easily be found out by doing an ultrasound test, then you certainly at a higher risk for stroke and should consider proactive treatment rather than waiting for finding out whether it'll be a come and go stroke. Stroke risk factors also include heart rhythm disturbances. Another term is called an arrhythmia. And if you have this, you are more likely to flick pieces of blood clot from your heart all the way up to your brain. It's a very short trip. How about heart disease of many kinds? Actually doubles your risk of stroke. So if you've had a heart attack and survived it, let's say you've had a heart attack, you've had bypass, you didn't quite have the heart attack, you had bypass or stents, you go to yourself, well, I'm cool, I'll come see you if I need you. Actually, you now have a double risk of stroke. Why would you want to risk your body like that and wait to see if maybe you might need treatment? Transient ischemic attacks, the come and goes, might come for years or months ahead of the actual stroke. I can tell you in my father's case, he stumbled and fell a couple of times before he had his first TIA. Now, happily, they've all been TIAs, but each of his little stories made sense. He didn't quite get his foot up on the curb as he was walking across the street, so he fell. Be suspicious that these episodes in older folks mean something much more ominous than just tripping and falling. So the second fall should be your indicator. We're going to go looking for problems. Now, you might think that I put this picture up for pancakes, but that's not it. I put it up for syrup, not for the sugar, although that is important as well. But certain blood disorders, especially thickening of the blood flow, which make it like pouring syrup instead of running easy fluid or water through your veins and your arteries. That, incidentally, is what we call a velocity problem as well as a volume problem. You're not getting the blood flow through as fast, you're not getting it through as easy, and it's sticky, it's sludging on the way. So these are not picked up by regular tests. However, we do have easy treatments to help reduce the stickiness of the blood flow. Another factor that causes stickiness is sickle cell anemia. Now, interestingly, you'd say, well, I'm not black, so I don't have to worry about that, except that in American history, and certainly in modern American history, with interracial marriage, we're seeing the genetic pool coming forward, so that there are people who have risk factors for this, and there are other Mediterranean anemias and such, and you don't know necessarily what your family background might be in carrying genes forward, certainly have another opportunity to show you sludge blood flow. What about cholesterol, triglycerides, HDL problems, and so on? Well, certainly in some circumstances, but not near what you would believe by looking at the TV. Couch potato is certainly more important than cholesterol and triglycerides. That sedentary lifestyle does get us important. And once again, we're talking about obesity. Another stroke risk factor, excessive alcohol intake. You know how easy it is to get to excessive alcohol intake? You probably wouldn't notice. Why? Because it's excessive, and you're not noticing much when you have excessive alcohol intake. So, you know, there is a good reason for interventions. It does matter. It makes a difference. And interventions can be for all kinds of different drugs. So I would encourage you, if you know someone who's doing illegal drugs, remind them that they're not illegal because it's bad law or good law or whatever. They're illegal because they cause major harm to people. How about response to stress? We all seem to have stress in our lives. It just gets worse the more it goes on, unless it gets better. Duh. Okay, it's back to the glass is half empty or half full perspective in our lives. The more we're able to look at it from that point of view, the less the stress is bothersome. Birth control pills, called BCP or OC, oral contraceptives, are especially important as stroke risk factors when a woman is also a smoker or when a woman is older. So keep these in mind as well. Aging and menopause, happily, because the alternative means you're not aging anymore. But that does bring along a stroke contribution. So certain stroke risk factors, like heart disease factors, can't be changed, increasing age, especially above 55. And you go, wait a minute, that's AARP age. I'm not old at that point. 60 is the new 40 or whatever. I don't care. You still have stroke contribution and risk factors. Male gender, once again, because we're the stronger sex, we're the one that gets hit by everything. Women on birth control, especially if they're smokers, especially if they have high blood pressure or other risks, and heredity, again, your family history does matter. Constriction equals blockage. I want you to remember that. Any kind, anywhere, it causes problems that can become quickly serious. Whether it's blockage disease, whether it's blockage disease that suddenly plugs up with a plug because of changes in the local conditions, or flips off one of the vulnerable plaque pieces, or just spasms down, constriction equals blockage. And you see it on the outside as angina, chest pains. It's most worrisome to daily life because you go, wait a second, this seems like a change that I'm not ready to have. And of course, the most worrisome for your future survival is having a heart attack. About 40% of the people who have their first heart attack have no indication in their history or physical condition that they're going to have one. They seem it comes out of the blue because they weren't told that they were going to be at higher risk. About 40% of the people who have their first heart attack simply wake up dead. They don't get a second chance. They don't survive it. First heart attacks can be pretty traumatic. So remember, I'll wait to come in and if I need you, I'll let you know, I'll call you. Maybe not. Heart and artery narrowing is the most common way we think of heart attacks. That's because the plugging is happening up. And everybody goes, well, I should eat my Cheerios because that'll lower my cholesterol 4 points or 6 points or 8 points. And that has zero to do with reducing your heart attack risk. As a matter of fact, if you'll check, most of the medications that are used to lower cholesterol have little impact, if any, on lowering heart attack risk. If you'll check, many people who have normal cholesterol have heart attacks because we're dealing with the mechanism here and it's not cholesterol related. We'll get into that more in the inflammation lecture. Again, remember vulnerable plaque because this is one of the most significant pieces you'll never hear. This is doctor talk. This is where that plaque can become very dangerous very quickly. Our job is to identify those people and get them to surgery as quickly as possible if we cannot make any major change with that. Artery spasm is what we deal with a lot. As the local conditions are changing with blockage, you get more tendency for spasm, and that is readily reversible, readily helped. Now you think of heart attacks as blocked plumbing, and you go, well, we better do something to make that work right. Well, we'll do Roto-Rooter. That must be how chelation works, is that it unblocks the plumbing. Except that, you know, in heart treatments as well as many other parts of medicine, if the only tool you have is a hammer, then a lot of the problems you see look like nails. So you use the tool that you have. And it turns out that, you know, thinking about things is much more important than doing things. Because if you think about it, you begin to discover where you might be not quite right. So you change your pattern of thinking. And it's important to do that because that's not at all how chelation therapy works. It's not a Roto-Rooter. On your way to surgery, a stress EKG might show abnormal tracings, and it might not. An echocardiogram is like they use for sonar in submarines. An echo can show areas of weak muscles. It can show flailing valves, poor overall function, even some areas of scar in the heart. The emptying fraction, or it's technically called the ejection fraction, is like if you squeeze a sponge, a wet sponge, you can't make it entirely dry on each squeeze. So if you get 50 to 70% of the blood that's in the left side of the heart out with each squeeze, that's considered normal. So when someone says your heart function has dropped down to 45%, they mean from 50. Okay, so it's not as profound as it might sound, and it's maybe not something you should say, I better immediately sign up for surgery. What you should do is sign up to get more information. Remember that unstable angina is one of the major reasons for operating early. That means pains with just sitting or pains that awaken you from sleep and are due to your heart. Now, here's one of the problems. As we get older, we get lots of other illnesses. So GERD, gastroesophageal reflux disease, which also feels like chest pains, can awaken you from sleep. So that's not a reason to go sign up for heart surgery. It's an important reason to do proper diagnosis. Ultrafast CT scanning, called the heart scan, can show areas of blockage in arteries without any dye, without any needles, very safely, and can give you an idea whether or not you have significant blockage disease. Now, often a regular stress test is followed by a nuclear stress test to outline areas of your heart. You can see the outlines here. These pictures show patterns where the blood is flowing to your heart muscle, and actually pretty normal looking patterns. However, there's areas where there are holes in this set of pictures, and there's less blood flow, which is dependent upon the heart arteries being open, and they could be in spasm, they could be plugging, they could be actually plugged. So it's a combination of putting together all these different pictures. People ask, well, you did that test and it only showed such and so. And I tell you, it's very simple. It's like taking a picture from the front of a car. You can see two headlights. How many doors does the car have? Don't know. Got to move around to the side and take a picture. What do the tail lights look like? Don't know. Got to move around and look at the back of the picture. So when we're doing diagnosis, we're putting together a whole set of studies in order to best outline your anatomy and function on the inside. Now, the coronary or heart angiogram is often called the gold standard. It is the next test just to be sure that you're okay since you've come into the hospital. Now, this arteriogram, or pattern of outlining the arteries to your heart muscle, sometimes works and sometimes doesn't. In other words, it is not always what it's cracked up to be. It's also called a cath. It's where a tiny tube or catheter is inserted in your groin or in your arm. It's threaded backwards to your heart where the contrast dye is injected. Here's an example of those pictures. The pictures are very pretty, and sometimes they show where your blockages are. Now, they took a set of cardiologists at one of the meetings, about 15, 20 years ago, said, we've got a study we're doing, we'd like you to read these angiograms for us. So they each read the angiograms, and then at the next meeting they came back and said, we're extending the study, we have to do some more in order to reach the conclusions we're thinking are there. They showed them the exact same angiograms. Now, it turns out that if you take a group of cardiologists, they can't read these the same way. They're making assumptions about how thick open it is or whatever, so that's about how much blocked it is. Turns out they can't read them like they read them before either. So the inter-reviewer and intra-reviewer, in other words, when you read your own, the standardization is certainly lacking. That's a little worrisome. Now, one of the things that happens if you have a heart attack or a stroke or TIA that seems to be progressing, things like this, is if you get in early, and I'm talking about in the first few hours, we can use clot busters that are injected to help dissolve some of the clots. This can restore blood flow. It is an incredibly successful procedure when done correctly. It has to be done early or it doesn't work because the clot begins to what we call organize and it won't be busted up. This is related to one of the products that we have in the office called thrombolase, which helps reduce the sticky blood. This is just fancy forms of the thrombolase. Balloon angioplasty is what they commonly do. This is where they run a tube through the blockage and blow up a balloon on it in order to slam the blockage into the sidewall of the artery. Now let's think, if this blockage is hard, that means we're breaking it up. So when you deflate the balloon, you might have pieces of hard blockage fall off the wall of the artery, go south, and we call that a heart attack. Yeah, that happens. It's one of the reported side effects. Balloon surgery is done for your heart. This is another view showing you how that balloon works. Remember that the balloon cannot be placed through every blockage area. It also cannot be placed through extremely tight blockages. That's a discouraging fact. Heart artery stents are like little Chinese finger puzzles built in reverse. They send them in stretched out. When they reach the area that the balloon has opened up, then they pop it open. The idea being the stent will now serve as a framework to hold open the artery. Now, the problem is that stents are an irritating feature, so you will often try to block around the stent. So they soak them in chemotherapy, they treat them with radiation so that they're now radiation therapy devices to discourage the fibroblastic change, in other words, blockage right at the area of the stent. So they often cause blockage changes of their own. You probably have friends who've had a set of stents, and a set of stents, and another set of stents. I mean, it's almost like just put me on the schedule for fall for my vaccinations and my new set of stents. Bypass surgery. Pioneered largely here in Houston by DeBakey and Howell and their group. It's called Cabbage surgery. It can both help and hurt. Cabbage is because coronary artery bypass graft almost looks like cabbage there. You see the different vessels that are used here, the internal mammary arteries that are taken, veins that are taken. It is real. They do use the heart-lung machine as part of the pumping system. Now what's interesting is, despite the fact that cabbage surgery has significant mortality and morbidity risks, that means staying alive and staying well, we act like lemmings marching to the sea, kind of unquestioningly. My doctor said I needed to have bypass surgery. If only you knew the right questions to ask of your heart doctors to make an informed choice. The surgery numbers are staggering. We do basically 1.25 million stents or angioplasties every year, about 500,000 bypass operations a year, and you would think somehow we would learn to do it different. The mortality is equally interesting, about 3 to 4% for bypass and for stents, and about double that for heart transplant surgery. I was at Stanford when they were developing the early bypass or heart transplant material. It was excellent. It was a lot of fun. But the Coronary Artery Surgery Center study, the NIH study, the VA study in the early 80s showed that 5 of every 6 would do better without getting surgery. That's 5 of every 6. Okay? Now, just to emphasize that, 30 years ago, these were the data. They've not changed. With far fewer medications back then compared to what we have now, far fewer elegant tests than we have now. So the question is, why do people continue to get stents and bypass when they don't necessarily need it? Now, 3 or more of every 5 survivors of heart disease who've been on the heart-lung machine, the bypass pump, will within the next 12 months suffer with heart attack or stroke, heart rhythm disturbance, heart failure, or worsening high blood pressure. All will suffer some degree of brain personality or functional change. That's interesting. That sounds like even though you made it through, maybe you didn't make it through. Worth knowing about. Now, a highly trained heart specialist team backs up every surgical team. You won't hear them recommending our treatment options here. Why? Because they do their treatment options there. So you have to find out from a friend, you have to share with a friend, you have to piece the puzzle together yourself. One of my good friends, Julian Whitaker, wrote a book called Is Heart Surgery Necessary? I recommend every one of my heart patients read it because it gives you the real studies, the real technical information. You can ask for our CDs and DVDs and brochures and the books we've written, as well as the recommended readings we'll offer for you and answers to your particular questions. Are you a ticking time bomb? Professor Grayboys, a cardiologist at Harvard, 20 years ago said in his second opinion study on doing bypass that it took about 3 years to catch up with the death rate for doing bypass surgery if you ignored the recommendation for surgery. If you ignored the recommendation, you had to go 3 years before the death rate caught up for the folks choosing to do the surgery. Whoa, wait a minute. That sounds like you ought to think about this before you just sign up. But Grayboys extended that. And people were saying, no, I've heard about this bypass, and you guys do pictures to make a map for surgery. And I don't want those pictures either. That's the catheter test, or angiogram, or arteriogram. But turns out it takes you about 3 years to catch up for the death rate for surgery if you ignore doing the angiogram as well. This information is available, it's known. Depending on your heart center, your surgeon, your age, your condition, death rates from heart surgery can range in 2 to 3% to over 10%. So just average it 1 in 20. The Cooperative Surgery Center study said that as compared with medical therapy, bypass surgery appears neither to prolong life nor to prevent myocardial infarction, that's heart attack, in patients who have mild angina, heart chest pains, or who are without symptoms after heart attack in the 5-year period after coronary arteriography, angiography pictures are taken. That was from 1984. They're saying, think about it. In the New England Journal of Medicine in 1997, a study reported the strikingly higher rates of use of cardiac procedures in the United States, as compared to Canada, which has a socialistic system, do not appear to result in better long-term survival rates for elderly U.S. patients with acute heart attacks. But we do go through the surgery. Now, effective treatment is available. We have prescription drugs, chelation therapy, nutritional supplements, dietary changes, oxygen support, exercise programs, balancing thyroid and other hormones. We talk about a coordinated program, but people hear chelation and don't know what it looks like. There you go. That's what it looks like. It's a casual, almost enjoyable experience. If we didn't use needles, it would be an enjoyable experience because you'd get to sit and chit-chat with people. But that's what it looks like. It's very anticlimactic. Blockage disease, we can often treat it without surgery. Chelation therapy works. Sometimes the blockage is reduced, sometimes not, but virtually every time your tissues become more efficient at their energy production and they become more healthy. Chelation does not require surgery to produce results, but we do recommend it if you are that 1 in 6. So when you come in, we're looking to identify who really needs to be referred for surgery. Now, we don't refer everybody because 9 out of 10 of our patients do dramatically better. 92% of those who do it for leg problems get dramatically better, 88% for heart problems, about 76% for those suffering with brain and nervous system problems. And whether you do better sort of depends on your pictures, because where your blockages are, how severe they are, how many you have, and so on. You might have so many blockages that, like the gentleman we heard earlier, you can't really have effective surgery because you're just too sick. I've actually had patients where they come in too sick for surgery, we get them better enough so they can have the surgery that they need. Now, your results with chelation as preventive or treatment will always be better if you start earlier, if you start younger, and before your condition becomes dire. So this idea, I'll wait until I need you before I come to see you, doesn't make sense. A little bit matters a lot. People say, well, how do you open my blood vessels? I don't have to open them much at all. If I just open them 16%, that's not much, just 16%. You can't see it on an angiogram. That doubles the blood flow because of the physics that are shown on these slides. Physics, well, oh gosh, no, we're not supposed to do that. We're supposed to do medicine. But medicine is based on physics, which is biochemistry and biology and all this put together. In other words, this is a real world treatment. And indeed, we can double the blood flow and dramatically improve the way you have lifelong health. That's the name of our newest book. There are 6 chapters on our lifelong health disc. I encourage you to read it. It's very entertaining It's a lot of fun because chelation really is a lot of fun getting people better. Toxic metals amplify the injury to your organs. They kill you. They make you sick. Remember that blood flow is always the key, and toxic metals are interfering with your blood flow. The rule of the artery is supreme. If you don't have enough blood flow to it, it suffers and dies. Whoa! If you're attached to it, that means you suffer and die. So chelation is nothing more than a chemistry concept of cuddling, pinching like a claw or a pincer, a toxic heavy metal and escorting it out of the body. That's all it is. Toxic metals block energy production. That takes the luster out of your view of life. Key to remember with chelation, it removes those toxics that block energy so every one of your tissues can repair themselves. So first we look for what's blocking you from feeling better. Then we remove it. Then we look for what you're missing, what trace factors are missing but you need to feel better. We provide them. And finally, we look for what switches need to be turned on in order for you to heal faster and better, and we turn them on. Because when life is your choice, failure is not an option. Chelation can help with increased vigor and vitality, increased concentration, a fortified immune system, increased resistance to disease, improvement in skin texture, and increased joint flexibility, reduced headaches, improved sexual performance, improved heart and blood circulation, marked improvement in angina chest pains, improvement in weight reduction, and increased capacity for physical activity of all kinds. It helps with chronic diseases like arthritis and diabetes, high blood pressure, depression, after effects of stroke, Parkinson's disease, Alzheimer's disease, a variety of heart diseases, and many other things such as chronic fatigue syndrome, fibromyalgia, chronic yeast syndrome, diminished vitality, even multiple sclerosis and mood instability, metal toxicity, clearly what we've been talking about, memory loss, osteoporosis, osteopenia, the list goes on and on and on. Chelation can help you, since only you can repair yourself. So, helping your heart disease, most certainly. What we do works. Now, we know what's important in our lives. We want to be healthy and happy. So why not choose robust health? That is an option that's available for us. It's right here now for the taking, literally within your reach today. So what do you do now? Dial 1-800-FIX-PAIN. Ask for our CDs, DVDs, recommended readings, brochures. Ask your questions. Get your answers. Because your body is your personal spacesuit. The same way astronauts get around in the hostile environment of outer space, you can improve your own personal spacesuit, get around better in this world, the dangerous environment of planet Earth, by doing chelation as you grow older and wiser.
I will tell you that I am from Louisiana, and I got up at 4 o'clock this morning to get here because it's a 5-hour drive, but it's worth it to come to see Dr. T. About 50 years ago, 50 and a half, I was diagnosed with rheumatoid arthritis. I was 14 years old. And so over the course of the years, I've seen a plethora of doctors, and they have tried every medication that came out on the market and that was new to medical research, and I've had all of them. All of them. You name it, I've had it. And I've had it for years. I had years of steroids and years of this and years of that, and methotrexate and everything else they gave you. 2 years ago, God led me to Dr. Trowbridge, and I am so thankful. It had been a very bad year. I'd had foot surgery and then got an infection and was in the hospital for a week with the infection from the foot surgery. And 2 days after they released me from having to go back to the doctor after the foot surgery, I got pushed down and fell and broke my hip, and so I had to have a hip replacement. That was after 2 knee replacements, and that was fine. I was walking around after that with no trouble. But then I got an infection from the hip replacement, and all these infections were due to all the toxic things they were giving me. And then I got all kinds of problems with bronchitis and had breathing treatments, and then I got a thrush infection, and then I said, hold it! I'm tired of listening to all these doctors that keep telling me I need more medication. And I read a book called The E Syndrome and starting doing the diet, and I said, this works! I lost 20 pounds just after I read the book and started the diet, and I made the appointment and saw Dr. Trowbridge. That was 2 years ago. He started me on an alternative treatment that my rheumatologist says is not approved. But it happens to work. In 2 years, I can walk, I can do anything I want to. I don't have any morning stiffness. I have no pain. I take the supplements. I take everything. I also found out I've got heavy metal toxicity of lead and mercury, and I have had for years. That comes from growing up near oil company refineries near Chicago and all the other stuff we have in our environment. So he's treated me by chelation, and he's treated me with the medications and the vitamins and supplements, and I am so thankful because it has helped me do everything. And so I've been retired since I was 46 years old on disability, and now I'm 64. And I now have a part-time job teaching online, and I'm really thankful for that because I'm so thankful because the next half of my life is going to be so much better than the first half of my life, and I can't wait till I can work full-time so I can spend more time coming down to Humboldt and having more chelation therapy treatments because that's going to work. Everything else does, so why shouldn't I? I will tell you this. I went to my rheumatologist, and I told him, he comes in after the nurse assistant comes in, and he says, well, what do you need this time, you know? And he says, any pain? No. Any morning stiffness? No. Do you need any prescriptions? No. And he says, what are you taking? I give him my list. He says, just a minute. He comes back. He gives me prescriptions for the same things Dr. T has given me prescriptions, says, I'll see you in 6 months. I love it. I love to go to my doctors and tell them, you know what? I'm being healed. You do a good job. Thank you very much.
I work for the police department. I'll get to the chelation part in a minute, but what got me to Dr. T is my shoulders. For years, I had problems with my shoulders. They were just kind of an annoyance more than anything else, thought it was normal. I actually went to a doctor one time after I had a little altercation at work one night, and he poked and prodded on me a little bit and put his hand on my shoulder, and I moved my arm around, and it popped 2 or 3 times, and his treatment and diagnosis was, And I didn't realize, since my shoulders had popped all my life, I didn't realize that was like a really bad thing. Nobody ever told me that was a bad thing. And about 2 years ago, one day I was at the house, wasn't doing anything particular, didn't fall, hadn't been sick, nothing. And all of a sudden, this was as high as I could raise my right hand. I could not get it up over my head. I couldn't reach under my other arm. I couldn't tuck my shirt tail in, couldn't get my comb out of my pocket. I happened to, as a minor issue, I tend to shoot with that hand. And I could get my hand up on my gun, but I couldn't get my gun out of my holster. I would have to come across my left hand and feed it out. Once I got it out, I was in pretty good shape, as long as you weren't up in a tree, because I couldn't get up too high. But as long as you kind of stayed level, I was in pretty good shape. But that was kind of an issue for me. And I knew I needed to get that fixed and get it fixed quick. And I'm thinking, man, I'm looking at surgery or looking at retirement or something, and I am too young to retire. So my in-laws had just sent us an article on prolotherapy. So I looked it up on the computer and like, man, this is something I need to look at. Let's look for doctors in Houston. Well, there's one over on the other side of the world. I'm packing a truck ready to go. My wife says, check Texas. Why check Texas? I just checked Houston. Check Texas. So we get Trowbridge. Instead of being across town, he's 6 miles from us. I feel guilty because there's people in there from all over the country, and I'm like 6 miles, so I'd sit there very quiet while they're talking about stuff. But needless to say, from not being able to get above this, up, down, sideways, it's embarrassing when you're putting your uniform on and your wife is tucking your shirt tail in because you can't get your arm around the back to do anything. Basically, it saved my career as far as I'm concerned. And I enjoyed shooting, been shooting all my life, and I figured I had some probability of some heavy metal issues from being around lead and assorted things forever. So I got him to check me, and you're supposed to be like less than 1.5 parts per gazillion, and I was at like 11. I was all the way across the page on the no-no side, so I like, okay, we need to fix this. So we started doing the chelation, and in about 8-month period, I went from 11 to 4.8 to 2.4 to 1.8 and got back down, and I had to agree with Dr. T when talking to him. You build these things up over your lifetime, and most people that we know that wind up having cancer issues or other, all of a sudden one day they're just really sick. Late 50s, early 60s, somewhere in there, and you build this stuff up all your life, and then one day you get one too many, and it just chain fires and starts a bunch of stuff that you just don't need. I knew I was in that situation of overloading myself to the point that one day I was going to get one too many something and be in trouble. I feel like now I have taken a proactive step in my health maintenance to where I will not have to deal with some of these issues. It's been being able to do anything I want now. I'm almost to the point that I can do just whatever I want to. I actually got to do a little bit of shooting the other day, and it didn't hurt for a change. So I'm elated. But as far as I'm concerned, T has not only hit a lick at a proactive side of keeping my health up, but also just he simply restored my career. I was planning on doing another 10, 12 years with the police department, and I was faced all of a sudden with retiring within 6 months or something because I couldn't handle it. I have not missed any work over it. There's a few days I've been to work I was pretty sore, but I've been repaired without having to be inconvenienced. The last guy at work that had shoulder problems had shoulder surgery and was off for 5 months, and he came back actually 2 months earlier than what the doctor wanted him to. But he was trying to get back in and work his extra jobs and started other odds and ends. But to that end, I can't say enough about it. You get to where you have a family of Dr. T people. My Tuesday people, since we tend to come in on Tuesday evening, my wife got her checked, and her lead levels I thought mine were bad. Hers were beyond horrible. She grew up overseas in oil camp. She was an oil camp brat, and there just had to be a lot of weird stuff going on back in the 60s and stuff when they were very concerned about environmental conditions. And we don't know where she picked it up, but she just picked up a lot of stuff. Now, I don't think hers had stuck quite as well as mine, and her numbers came down quite rapidly once we got going on her chelation. But between her chelation and hormones, I got Dr. T, like I gave her this woman, and he Stepford wived and gave me a different woman back. So I've been quite pleased in that regard.